My name is Anne-Catherine Guio. I work in LISER as a research fellow. Here in LISER we cover a large range of topics, ranging from birth to old age. For example, access to healthcare, access to childcare, education, housing, mobility, pension, etc. But what is really our DNA is we don't do research for the sake of research. We do research to have an impact on society, on people's lives. And what is really important for us is to have enough evidence to provide evidence-based recommendation to policymakers. Let's take, for example, two research that we conducted during the last years. The first one was requested by the workers' chamber, the Chambre des Salariés, about non-take-up. So what is non-take-up? As you know, there are many allowances targeted to low-income people here in Luxembourg, for example, allocation vie chère, housing allowance, energy allowance, education allowance, etc. And what we see in the figures is that the people who are entitled to these allowances don't necessarily have it, so cannot rely on these allowances because they don't want to ask or they don't know enough that it exists and so on. So we don't know exactly why, but we see that the take-up rate is not 100%. Sometimes it's very far from 100%, it can be 20, 40%. So we have really a problem of non-take-up here in Luxembourg, but everywhere in the world, this is really a challenge. And what we wanted to know is the reason why these people don't ask for these allowances. So we made a qualitative survey asking people in detail what are the barriers to access to these allowances, and based on this we made a number of policy recommendations. A second example is an European level example. We coordinated a big research during years about the poor children access to essential services like childcare, like education, like healthcare, social housing or food. It was really important to map in all countries the country-specific barriers which prevent the children to have access to these services, because it's essential in terms of quality of life, quality of the future life, equality of opportunity for these children. So we made this mapping relying on this big network of researchers, and then we were asked by the European Commission to compute the cost of providing free access to poor children in the whole EU for all these services. Quite difficult to compute this cost, but it was also very interesting to show that it was affordable for the countries, for the member states to provide, to guarantee this access. And this led the European Commission to propose a Council recommendation on the European Child Guarantee, which was then adopted by all member states, and now poor children are supposed to have free access to all these services in the whole EU.